Assalamualaikum warahmatullahi wabarakatuh and a very good morning. Today we are going to be presenting our final project which is regarding medical part. My name is Nur Shahidatul Shara binti Sharif Nizam.
I am Ala Zafira binti Zainal.
I am Muhammad Amin bin Abdullah.
I am Nurul Syafiqah binti Aminuddin.
So we are going to be starting with our presentation. As a brief introduction for this project, which is as can be seen during this current pandemic of COVID-19, there's increasing number of patients who comes to hospital and clinics to make a medical checkup, and it is very important for everyone to keep themselves safe and prevent from getting infections. With the invention of this medical pod, it actually could help in health sector from the issues gathered could give a safe and efficient process for medical checkup. As can be seen, there are 5 problems that can be tracked to develop this medical pod, which is the first one is people need to make a long queue and wait for their turns. The second one, they are exposed to other patients, which is difficulties to implement social distancing. The third one, hospital and clinics have different procedures and it is time consuming. The fourth one, the medical checkup results did not get on time. And the last one is it is difficulties to make appointment with specialists for further checkup. Next. Okay, as can be seen, there are 3 objectives, which is the first one, conducting a survey to get response from the public regarding the problems that currently occur at the hospitals of their experience. And then from the conducted survey, the data collected need to be identified, the information to gather the requirements to develop the medical pod prototype. And the third one is from the requirements, we need to develop the pre-diagnosed medical pod based on the information that has been gathered from the survey. For the scope, the this medical pod developed for patients who is focusing on quick, efficient diagnosis. Also, this pod developed to ease the diagnosis process and make the medical checkup procedures efficient. The significance of this project is that it is save time for in the medical results, data and queuing, and also medical checkup process. It also provide accurate diagnosis data. The pod is actually safe and secure and keep its hygiene every time. And also it provide contactless services, which is very important during this current pandemic. Next.
Next is a future tools that have been used in developed medical pods. First is a horizontal scanning. For this project, 5 papers have been picked for horizontal scanning based on health, educational, social, and entertainment from year June 2020 until October 2020. Okay, this is 7 questions that we have come out to insert in the questionnaire to gather information. First, we have how often did you get a medical checkup? And second, what would you go for a medical checkup? Is it for a minor or major illness? Third, how often did you go to the pharmacy, clinic, or hospital? And fourth, how long is the average time for the time taken a doctor to visit you? 5, what are the features that should be covered in the medical pod? 6, from the experience of attending a physical medical checkup, what the problem that you hope that medical pod can solve? And last is, how do you think the medical pod is beneficial for future health management?
Here we add the use case. There are 4 main characters, that is clinical admin, patient, next slide, technician, and medical pod itself. All the process will be shown in the video at the last session. Next.
Next is issue paper. For issue paper have been found in this paper, it is time, example like time consuming. Second, safety in use, it is safe design. Third, technology, full complete body check. And lastly is user friendly, it is multi-language.
Here we add the driver mapping. For the theme that has been used is pastel. It contains the political, economic, social, technological, environmental, and legal. These all are the drivers that are available in each part of the pastels. Next.
Okay, this is feature wheels for medical board, which we came up with 5 direct, 11 first order consequences, and 2 second order consequences. Right, next.
These are the SWOT that have been gathered from the development of the medical port. As can be seen, with the strength that with the strength this many, we can surely the project will success. The more the advantage that have been find, the more the development of the process will be success. Okay, next.
Next is the roadmap. Roadmap is a strategy plan that defines a goal or desired outcome to reach the project. This is a medical port roadmap from 2019 until 2024.
And here are the software and the hardware that we use to develop the medical port. There are several laptops that been used like Acer, Lenovo, and the Asus, and several software that we use like the PowerPoint, Adobe Photoshop, 3D Paint, Premiere, and the Canva. Next.
Okay, this is for the development progression. There is 4 software that we use for developing the medical port. First, 3D Paint for develop the prototype of the medical port. Second, Adobe Premiere for video making. Third is Canva to make the storyboard. And last one is the Microsoft PowerPoint for prototype animation.
In conclusion, the development of medical pod is very beneficial for everyone, which that it provides an efficient diagnosis process and solve the problems that is being faced currently, especially during the current pandemic. With this medical pod technology, it can actually be used in the future for the enhancements of the existing healthcare services. That is all from us. Thank you.